Hi everyone, so this is a short tutorial on atrial myxoma. Please take a note of my email address and Instagram account. Feel free to connect with me if you have any questions. All information contained in this presentation or any of my tutorials are for educational purposes only and only for use by myself. They should not be used for the diagnosis or treatment of any health problem or disease. And the information contained in this tutorial is not intended to replace clinical judgment or to guide individual patient care. So without further ado, we will start our brief tutorial on atrial myxoma. So this is the most common primary cardiac tumor, but it is rare. It occurs at all ages, there's no sex preference, and most are sporadic, however some are familial. And usually they're solitary, occurring in the left atrium, as you can see in this picture here. So they occur in the left atrium, and as you can see there's a mass there with a peduncle. They're usually polypoid and gelatinous structures. So you saw in the previous slide, they're attached by a pedicle. They can obstruct the mitral valve. They can also be the site of thrombi, which are clots, which then may embolize and cause symptoms such as a stroke or a pulmonary embolism, depending on where the myxoma is. Constitutional symptoms include shortness of breath or dyspnea, syncope, or a mild pyrexia. On examination, you may find that the patient has a loud S1 and a tumor plop. The tumor plop is a loud S3, as pedunculated tumors come to an abrupt halt. There may also be a raised ESR. As you can see on the echo, there is I just draw a line there. You can see there is the atrial myxoma and there is the peduncle. And this is an echocardiogram, and the cure is surgical. Atrial myxomas can occur also in the right atrium or the ventricles, and there are other tumors which include rhabdomyomas and sarcomas. Here is an echocardiogram where you can see that there is an atrial myxoma sitting up in the left atrium. Right there. Again, you can see the myxoma and how it can obstruct blood flow and affect the valve leaflets. Again, this is an apical view on an echocardiogram. So the histology, this is low yield stuff, but it's a good idea to know something about myxomas. They're complex structures which resemble cords, nests, rings, or poorly formed glands, and they often surround blood vessels. They're composed of stellate or globular myxoma cells with eosinophilic cytoplasm, indistinct cell borders, an oval nucleus with open chromatin and indistinct nuclei. They have an abundant mucopolysaccharide or myxoid ground substance containing chondroitin, sulfate, and hyaluronic acid. And as you can see from this histology slide, you have a myxoma on the right-hand side. Again, low yield, Carney syndrome. So if atrial myxomas were rare, 10% of myxomas, cardiac myxomas, are as a result of Carney syndrome, which is an autosomal dominant disorder where you can have multiple cardiac and extracardiac myxomas. And as you can see on the right-hand side, they may consist of spotty skin pigmentation, cutaneous myxomas, the cardiac myxomas we spoke about, mammary myxomas, testicular tumors, schwannomas, GH-secreting pituitary tumors, etc. These tend to affect younger patients with a mean age of 24, and it's usually in men. They're due to mutations in protein kinase A, regulatory subunit 1A. So, in summary, an atrial myxoma is a rare heart tumor found in the top chambers, usually in the atria. Around 3/4 of atrial myxomas occur in the left atrium. They tend to grow on the wall, so the septal wall, that separates the right and the left sides of the heart. They are benign, which means they do not spread around the rest of the body like other cancerous tumors. However, because they can grow quite large, they can affect how the heart works. And they can affect the pumping of the heart. So if you recall that echocardiogram we saw, you saw how the myxomatous mass could obstruct blood flow and interfere with the valvular leaflets of the heart. So in addition, sometimes small pieces of the tumor can break off, and as they fall into the bloodstream, they can either block an artery or they can embolize, causing a stroke or causing a pulmonary embolism if they go to the lungs. Some of the symptoms you should be aware of with atrial myxomas are that patients may come with a high temperature, pyrexia. They may have a cough, breathlessness, palpitations, dizziness. They may have some weight loss. They may be tired, complaining of some chest pain or discomfort. They may have Raynaud's phenomenon, which is a bluish discoloration to the skin, especially in the digits. 10% of myxomas are inherited, which means they pass through families, which we've just discussed. And these are known as the familial cardiac myxomas. These tend to occur in more than one part of the heart at a time. And they tend to manifest themselves in the younger age group. Atrial myxomas, however, tend to be more common in women and are sometimes associated with valvular heart disease. And they can cause atrial fibrillation. And a quick summary on how atrial myxomas are diagnosed. Well, patients will usually have an ECG, possibly a chest X-ray, but the diagnostic imaging modality of choice is an echocardiogram. There are other tests that could be done, such as a CT scan or an MRI. Atrial myxomas need to be removed during open heart surgery. However, once the myxoma has been removed, symptoms should disappear and patients can continue their usual lives. So that means heart surgery or cardiac surgery normally means cure. However, in a very small proportion of patients, atrial myxomas can reappear. And this summarizes cardiac myxomas. So thank you very much. My name is Dr. Bhatti. I'm a consultant in emergency medicine. Please feel free to contact me and subscribe to my YouTube channel.